Hello everyone, a very good morning to one and all. Hope you guys are nicely settled in because this is going to be an exciting day. So yeah, I mean it's going to be an exciting day. I'll just walk you guys through what we are going to do here. So we have some good talks to be presented. I'll kickstart with talking about personalized care with wearable health data, and we are going to have Sandeep Krishnappa talking about implementing blockchain with healthcare data sharing. We are going to have real-time anomaly detection being spoken about by Rajesh Bose, and we are going to have AI-powered content creation in healthcare by Ketan, and we are going to have a talk by Apoor Sahu on AI-driven mental health solutions, and obviously wrapping up with AI-powered telehealth assistants by Srini. So yeah, I think everyone is in a role for this one. Let's get started. All right. Before I jump into talking about personalized healthcare, let's have a bit of discussion on what is the current state of healthcare right now. So I mean it's in a pretty good state, isn't it? Right, going in a good direction maybe. And though with the innovations in AI, it's getting pretty exciting, which is taking patient care to the next level, right? Be it hospitals, healthcare providers, or patients themselves. So the welcoming changes that AI has brought has been helping everyone around, right? We do see some challenges here, like there are delays in kind of access to the patient data, and we see rising costs for healthcare delivery, right? And obviously, with the healthcare providers getting too much into administrative burdens, we do also see kind of a burnout for them, right? So these are some things I think still can be improved in the ecosystem. So I mean, what's the major reason I see is due to result in obviously a mismatch between the complexity of the care and obviously on the availability of clinicians to provide that care. So how does AI and these things helps in kind of solving this problem statement, right? So hello everyone, this is Manav Goel. I am currently learning and leading healthcare technology at GeekyAnts, and I'm going to talk about AI-driven personal care. And what do we exactly mean by personalized care? I'll be talking about that and how we can integrate and utilize wearable health data with that. That is going to be the focus of my talk. Yeah. So how does AI help? What I feel is that it helps to unblock a lot of opportunities for patients and better manage self care. So it's more about when we say that like availability of clinicians is a problem, right? Burnout of doctors is a problem. So why not focus more onto patients managing themselves, at least up to a level what they can. That can be a good model to speed fast things. And here AI helps to move from rather one-to-one sessions to one-to-many model of care, which is superb. And it also improves the engagement of the users and give them a good experience of managing themselves. And use of gen AI for kind of personalized tutoring in the education sector gives us a good learning point for this as well, right? What how does personalized data helps? So what I feel is that whenever patients see personalized data being talked upon or given to them an environment where they can talk about their own persona and deal with themselves, it kind of increases involvement, right? In our daily habits, in our behavioral changes. And those patient centric data emphasizes on their perspective and their preferences, right? And obviously let's just say that a person is going for their own healthcare journey transformation, right? That is kind of a consistent thing everyone would want, not in a peak state, right? There some behavioral nudges with some health tips, some reminders, and an ecosystem where it helps them propagate that really motivates people to adopt healthy habits, right? Coming on to a short case study that we did. So if you could see the graph here, it depicts the number of AI ML enabled devices which were approved by US government FDA in this time period from 1995 up till last year. So if you could see here, This is what tells us what like AI has like provided, what kind of a boom AI has provided. The first AI enabled device was registered or approved in 1995, and then roughly around 2015 we got like six approved devices. But last year in 2023 we saw a boom with over 200 devices being approved by the FDA to be utilized. Obviously those devices were majorly in the radiology section, obviously because there more and more investigations and documentations and scanning and those processes are involved, which gives a kind of opportunity for AI to leverage and speed fast things. So that was kind of the first segment in healthcare that took it beautifully, and obviously other segments are like following in the chain. But yeah, I mean, like this tells us that it's going in a very good direction. How do we like go about building like an AI powered wearable health device? So like this does not fall directly into medical devices, but yes, wearables and IoT are taking the talk of the town right now. Yeah, so this is I'm going to talk about a short experiment that we tried to do at GeekyAnts. So what we were kind of building is that building on a problem statement that we need a customized health plan for people to simplify their engagement process, and existing solutions really show that there is a gap in automating this process, right? So this was the problem statement we started with. Like it has like various like key pointers here. We need to have like proper data collection from wearables and the devices that people are utilizing to get vitals, maybe nutrition information, activity information, and daily workout stats and everything. Moving on, we need to have a proper data storage and processing of this information to generate insights and actions by utilizing whatever AI models we can, and then obviously provide them with a customized healthcare plan that can help for providing actions and insights to go through their like healthcare transformation journey. So these were kind of like some business pointers we wanted to start with. uh, Yes. So how do we go about implementing these? So these are the major segments that we focused on. One was to have sorry for yeah. So one was creating personalized health plans. Here, like like we need something that has real-time adaptation built in. For example, let's just say that a user registers and provides their like profile information. What are their like vitals, height, weight, gender, and all of those things. Now, let's just say that there are some changes that the person makes, right, during the transformation journey. So our customized plan should be adaptive enough so that they can modify as per the changes are going. Like for example, during the following the plan, they got a ankle sprain, right, and they put in that particular information as a profile updation. So the customized plan should adapt accordingly so that those things can be taken into consideration. Maybe change the workout sessions, change the dietary plan, what they can be suggested. And also we try to integrate a knowledge base backing for this one, because we need these things to be really accurate. I mean, that is the catch here, right? We are talking about self management, self care, and we are like moving a bit away from one to one healthcare professional setups. And if we are trying to suggest something like that, it has to be accurate, right? And the only way we can make those things it is to have a knowledge base to refer to for the AI models. So we utilized AWS Kendra for this one, wherein we stored scientific papers, medical researches, nutritional databases, and vetted, medical guidance, which can be referred. Next up, we need to provide obviously intelligent health coaching by utilizing like natural language processing, so that people can communicate with the platform in natural language and get evidence based activities and suggestions, and obviously try to somewhat make the model in like understand the context and not go out of it. I'll focus on to more when I'm proceeding with the slides. Then moving on, we need proactive health management. This is more like the point I mentioned about being consistent, right? We need proper health monitoring, we need real time updates to the user, so that it's more about hooking them and bringing them back, right? Obviously it's a marketing strategy for making our app work as well, but if in a healthcare journey the person is brought back to their goal and told them daily what they need to do, what they are doing good, this helps a lot in the longer run, right? And we have to build some kind of a smart notification system that enables them without being too nudgy, right? Then obviously the last part, which is comprehensive health data integration. To make this possible, we need to be like on top of our game for data collection, for storing the data, having all of like multiple devices integration possible, from wherever we can gather that profile information as much as possible, and obviously storing that data in an encrypted format and transforming it so that it becomes easy for LLMs to like be in the scope and get that context right. So for personalized health plan, if you could see, these are some example prompt templates. These are white labeled things, so not to be like taken up as it is. So this is for creating the like LLM chain that we like design a prompt template that says we this is this is the AI designed to create tailored health and fitness plan from user data. We tell what should be the communication style, what should be the goal, and for the chain, for creating the LLM chain, we pass on data like user profile information, the knowledge base that I talked about, the prompt that I need to send, and obviously we utilize AWS Bedrock model to like execute it. And for if a user like consistently struggles with morning walkouts or something, so what do we want to do is that we give them a customized plan wherein like suggest evening session instead, or if the heart rate data shows excessive strains, then probably like dial down the workout intensity or something. So those things are leveraged from the user profile information that we pass on into the chain. Moving on to proactive health management. So here our main purpose was to have real-time monitoring and smart notification system. The aim here is to provide that like proper motivation that engages the user and maintains the continuity. So for even for this one, we created a separate LLM chain. We passed on majorly the user activity data, because now for daily notifications, the daily activities and past days activities are much more important. Obviously passing on the personalized plan makes it easier to link those daily activities with the customized plan that we offer, so that those can like fall into the same line and can be modified as per like user input. And obviously the knowledge base that I mentioned and prompt and the same bedrock model. So what we did was we provided kind of three basic notification system, which is give them a morning notification with some constructive message that yay good, you are working onto this one, and these are some things that can be improved upon, and for today to match your goal, these are the actionable insights you can go ahead. Maybe commenting on the yesterday's diet plan that they followed, like to give them that interface where they feel that they are talking to like a health buddy, right, who is helping them with their journey. And similarly we have evening notifications and daily actions. uh, what we try to do with this notification system is kind of use like behavioral psychology, so that we can jump into that and have timely reminders for responsiveness patterns, right? So that user is able to adhere to that and responds to that with their activities and everything. We do adjust the notification frequency also to prevent alert fatigue, because like no one wants to being disturbed by a lot of notifications, right? And for real-time monitoring, things like unusual heart rate variations, sleep patterns disruptions, stress levels spikes, and deviation from normal activity levels, these were the things that we focused on. Moving on, for health data integration, we connected with we had a support for major fitness tracker and smartwatches. so that we can connect with Apple Health, Google Fit, and things like that, and get those data being synced. We utilized a third-party library. Currently, it's okay. It's TriVital. We are getting real-time information out of it, and we had our webhook linked with that, so that those activity data can be captured and can be transformed and stored with us to create those plans and the daily notifications that we have. So what were the challenges that we faced? So majorly for creating personalized health plan, we need to have the ecosystem that we have built reliable enough so that it can have kind of a multi-region support, and the data that is stored with us, which we will be working in the background, should be available enough. So we implemented real-time data replication. We also had real-time performance metrics. We imbibed automatic scaling for management of load. We had service dependency monitoring in place. We also focused on user management as a challenge, because when we were thinking about motivation strategies, this was the most important. How do we have achievement milestone tracking, and how do we create those adaptive feedback mechanism, and people feel connected. I mean, the more personalized it gets, the more easy it becomes for users to be hooked, right, and follow it in a processly manner. So these were the major challenges that we focused on. And then came a point where we thought these are something which is user activity based, right? So we need something which is what do you say, which is quite real time, and we need a chat bot so that people can come up with random queries also, rather than just having a customized plan and some daily notifications which is generated from the system end. So it should be more that user are able to interact with the system based upon their availability. So we tried to build in a chatbot for this one as well. And here, the major business prospects were that we need a platform for users to interact. We need obviously the daily notifications built in with the chatbot, and we need monitoring and feedback so that we can understand how the chatbot is performing, right? The major implementation details were we had to focus on the technical implementation of the chatbot. Similarly, we utilized AWS Bedrock for the implementation, and the major thing here was to manage the context, so that whenever people are chatting now, here the things becomes critical, because the user can put in any kind of quote, right? It's not only about the profile information, where we kind of scope them in, that you have to provide this information, you cannot go beyond the scope. Here they can put in anything and everything, right? So here it becomes challenging how to bring the Gen AI into the context and not let it lose it. uh, so these were the major things that we were focusing on. This is roughly how the architecture looks like. So if you can see that we have data ingestion. Is it visible? No, I'm really sorry for that. Okay, I'll just skip that. I'll just tell you what we integrated in this one. So we had obviously the data collection. We had event trigger pipelines built in. We have the conversational interface that talks with the LLM coach for providing obviously the notifications and the daily chatbot that they can utilize, and the customized plan. So this is just depicting all of those things. I'm really sorry for the quality. So similarly, as we were creating LLM chains for notifications and for the customized user plan, we created one for chatbot as well. Herein, obviously, the question that the user asks goes in, and it takes the context with the user profile information, the plan we created for them, the daily activities, and the knowledge base. Everything goes in together with the query that they raise. Uh, the challenges that we faced here obviously was limitations for technical implementation. We utilized Langsmith for logging and monitoring, so that we get to know that every pipeline gives out as an output, and we can monitor that. We had created obviously AWS Kendra for single source of truth, and for performance optimizations we required for chats we required cache management, And obviously we created separate LLM chains to keep separation of concerns, and indexing strategies, so that we can have queries faster. We also dwelled into managing AI bias and hallucination, right? So we utilized pydantic library so that we can have proper formatting and limiting the validations, so that it doesn't go out of scope and remains into the context. And we set proper guidelines. I'll come on to that later as well. So this is a way that we try to mitigate the hallucinations. The strict guidelines that we tried to inculcate was, if the user is asking anything apart from healthcare or fitness, it needs to tell that it's only a health and a fitness assistant and not a medical advisor. And any response that comes in should be very minimal, with 20-30 words and maximum of two sentences. So these were some ways that we tried to limit things and keep them in scope. Coming on to some ethical considerations. So obviously, when we are dealing with healthcare data, it becomes vital that we have some security and privacy guidelines built in. So to mitigate that, mitigate unauthorized access, we collected only the data which is necessarily required, and separating sensitive health data from user information was another thing. For security, we implemented multi-factor authentication and some guidelines of HIPAA compliance as well. Not truly HIPAA compliant, but some guidelines which we could follow at that point of time. We are still incorporating those. And obviously about medical accuracy, because we need those, as I mentioned earlier in my presentation as well, that if we are moving to one to many patient care, then we need to make sure that we follow a medical knowledge database, and integration with good medical resources is required, and periodic audits are required so that those remain up to date and in the context. Another thing that we followed for data privacy obviously was masking personal information like email and phone. This is just a sample to showcase that. And obviously, if we are dealing with LLMs and we are passing prompts, then it's necessary that we don't pass raw data to LLMs directly. We need to transform that data, mask it, and then pass to LLM so that it cannot be traced back and still give you accurate results. So this is just an example of how we kind of did that. Moving on, as I mentioned about medical accuracy and boundaries that we set. So these are some prompts that we tried to utilize for ethical boundaries, like do not provide any direct medical advice or diagnosis, refer to healthcare professionals if there are some medical concerns that are highlighted in the chat, and have a clear distinction, because this is just for guidance and not medical advice. That is really important to be told again and again to the user. And yeah, I mean, these were some things that we tried to keep in scope. Yeah, so what does the future look like? Obviously, this AI driven medical care has been a topic of discussion in the medical industry for last 1 or 2 years, and the same trend seems to go into 2025 also. uh, the sheer volume of data being generated, it becomes overwhelming for existing systems, and it makes the analysis complicated, and impacts on decision making. So a fun fact would be that the data generation of approximately is 30% of the global data is produced by the healthcare industry, and which is mostly out of wearable devices. And the reason being, the clinical integration of variables are increasing, right? They are being incorporated into clinical workflows, and even patients and people are utilizing more for self care. Like for example, most of us own smartwatches and fitness trackers, right? And that becomes essential for health conscious individuals who are following those plans. So yeah, I mean, this is it, I guess. If you find this interesting, you can have a listen to this podcast as well. It reflects onto the same topics. Yeah, that is my time. I hope the tone is set good for the day. We have some many more interesting stuff coming your way. So yeah, enjoy.